Good morning. It's 5. It's almost 5 o'clock. Today is Wednesday, May 27th, and no, 8th. I figured this out here. Surgery was on the 22nd. It was on Thursday. No, it was not on the 22nd. It was on the 20th. Okay. So it's the 26th, May 26th, and almost 5 o'clock in the morning. One of the things about doing this without a script and without notes is that I know I'm repeating some things. I thought of some things regarding the first days after surgery this morning that I want to tell you about, and then I'll just kind of tell you what's going on now. It is one of the things that I wanted to mention right after surgery was that I couldn't talk very well. I couldn't string my thoughts together, and I wasn't irrational or hallucinating or anything like that. It's just that having had the breathing tube on my throat and had so much fluid pumped through me during surgery that it was difficult. My mouth was so dry, and it's kind of dry this morning, which is one reason I thought about that last night to include it, because I'd gotten to the place where my mouth wasn't as dry, but now it is a little again. There was another thing about surgery, about right after, that I can't think of right now, but I probably will. Yesterday, I had my central line replaced because it had broken, and so they wheeled me down. And one of the interesting things to me that I had this observation yesterday, since I live in such a small town, the population of my town is about 3,000, and when somebody says they're going to do something in a few minutes, or they're on their way, that means that the doorbell is going to ring any second. In fact, a few months ago, I had a person who was giving me a bid to do some work at our house, and I had other relatives there visiting, and the young girls were playing a game of Uno or something on the living room floor, and the man said he would be right over, and I literally hung up the phone and had just walked into the living room, and the doorbell rang, and my niece looked at me and she said, "Did you just not hang up the phone? Weren't you just talking to him?" I said, "Yeah." So when you tell somebody it's okay for them to stop by, you better be prepared for them to stop within the next 5 minutes. Here it's so different because the hospital has, I think I mentioned, maybe 8,000 employees, and it's a huge campus of buildings, and so in order to go have that procedure done, transportation had to come and pick me up, take me in my bed over to a different building. So we went down the hallways, down an escalator, down some more hallways, to another escalator, up to the 8th floor of that building. Excuse me, we're going to have to get some water. The 8th floor of that building, and then into a holding area. I was in the holding area for half an hour or so, and then had the central line replaced. Had to go back to the holding area for transportation, wait for them to come pick me up to bring me back to the room. So it took 3 hours for that procedure that only itself took about 20 minutes. But you don't do something. When they told me that they were on their way, I thought, oh, great, I'll be back by breakfast time. Well, I missed breakfast by a long shot. The day yesterday went pretty well. One of the things that the doctor mentioned when he was in. Dr. Bridwell and Dr. Kang came together to see me at 6:30. That's their normal time for rounds, and so it'll be about an hour and a half till they're here today. But they decided to keep me at 10 degrees elevation for my head, and right now I've got the bed flat because I slept on my side most of the time last night, and so it was when I am on my side, it needs to be down flat, but if I'm on my back, it can be raised to 10 degrees. As you can see, my head itself is higher than that. My spine is fairly straight right now. There's a lot of noise outside my room, so they may be coming in to do something. I'm not sure. Yesterday I developed a rash, an allergic reaction to the sheets. Actually, it had happened the day before that. We'd noticed a lot of little bumps on my skin, on my neck area, and up to my hairline, and on my back and on my legs. And the nurse thought that it was an allergic reaction to the harsh chemicals that they use in the laundry detergent in order to keep the hospital linen supply safe. And so they were able to order a hypoallergenic set of sheets and gown and different things. So even washcloth and towel. And so that came last night, and last night was the first. Hi, good morning. How are you today?